During a newborn's first year, parents will listen to an average of 2 to 4 hours of crying every single day. For an exhausted mother or father, that wall of sound is a blaring alarm demanding an immediate solution. The sheer exhaustion is compounded by the endless guessing game. By the time the late afternoon witching hour rolls around, trying to figure out if an infant is hungry, tired, or in pain feels like defusing a bomb in the dark. But that chaotic noise actually follows a strict biological code. Before they can utter a single syllable, infants employ a highly specific communication system. Babies possess a universal library of distinct sounds and physical gestures. Every squeak, gasp, and rigid movement maps directly to a basic physiological need. Recognizing crying as a structured communication system transforms a parent from a helpless victim of noise into a capable translator. The translation process begins long before the actual crying starts. In their first few months, babies produce what researchers call pre-cries, purely physiological vocal reflexes that emerge before a full emotional meltdown. In this cross-section, the sucking reflex pushes the infant's tongue against the hard palate. Air passing through this shape produces a distinct "ne" sound, signaling hunger. If the problem is trapped gas, and air sounds are created by excess air escaping the digestive tract. And when an infant cites exhaustion, their facial muscles naturally fold the lips inward right before a yawn, creating an audible O shape. These phonetic patterns are so consistent that modern computer scientists have built voice-based artificial intelligence capable of categorizing these specific sounds with up to 95% accuracy. Researchers at UCLA compiled and analyzed a database of over 20,000 individual infant cries, teaching an algorithm to decode the exact same biological tells that parents can learn to hear at home. Catching and identifying these microsignals stops a crisis. If you respond to the pre-cry, you resolve the physiological need before the baby is forced to rely on sheer volume. Of course, you will occasionally miss those early signs. When a pre-cry goes unanswered, an infant escalates to a full wail, completely altering the acoustic structure of their output. This waveform shows the rhythmic structure of a calling cry. Notice the even, pulsating peaks separated by distinct flat pauses as the baby stops to listen. For acute pain, the pattern breaks into a harsh, continuous spike, lacking rhythm, punctuated by sudden shrieks. Then there is the colic anomaly. Usually striking in the late evening, this is a total system override, an intensely painful, inconsolable wail that can persist for hours at a time. The physical shape of the sound wave itself is the infant's primary tool for broadcasting the severity of their specific emergency. Audio alone leaves room for translation errors. To accurately decode an ambiguous cry, you have to observe the infant's physical body language, which provides vital contextual modifiers. The hands offer an immediate diagnostic test. A perfectly relaxed hand indicates satiation, while tiny fingers locking into a rigid, high-tension fist signal urgent hunger. The timing of a movement is just as telling. If an infant aggressively arches their back while feeding, it points directly to painful acid reflux. If they perform that exact same back arch after a meal, it simply means their stomach is full. And when a baby forcefully draws their knees up to their chest, they are making a mechanical, bodily attempt to apply pressure to their own intestines and pass trapped gas. Vocalizations without body language are only half the sentence. An accurate translation requires reading the audio and the visual together. There are strict boundaries to this language. If you hear an atypical, high-pitched shriek accompanied by extreme lethargy or a fever over 100 degrees, the translation process yields to absolute medical intervention. For standard distress, where decoding fails, you can rely on physical intervention strategies. Wrapping a baby snugly in a swaddle while playing continuous white noise mechanically simulates the security of the womb to force a calming reflex. Even with the best tools, there will be moments where an inconsolable cry defies all logic, pushing you to a psychological breaking point. The frustration and dread in those moments are entirely valid. Placing the baby safely on their back in an empty crib and stepping out of the room for 10 minutes is a necessary and healthy physiological reset for an overwhelmed nervous system. Mastering this biological language effectively silences the immediate wailing, while forging a synchronized, lifelong communication bond between parent and child.